to the HealthChangers podcast, presented by Cambia Health Solutions, where we share real stories of healthcare transformation from those experiencing it and those helping to make healthcare more personalized. I'm your host, Kilaa. In this episode of HealthChangers, we'll visit a barbershop that's helping African American men keep their blood pressure under control. This innovative program is called Cuts and Checks, and there are similar initiatives in at least 8 cities across the country. But first, we'll hear from some of the people involved in getting the Cuts and Checks program up and running. They're with North by Northeast, a community partner of Cambia and the only primary healthcare clinic in Oregon devoted to African American health. We'll hear from North by Northeast co-founder, Dr. Jill Ginsburg, as well as Sharetta Butcher, a community health care worker who oversees the Cuts and Checks program. And we'll also hear from Dr. Kenji Taylor, a physician who helped start a similar program in the San Francisco Bay Area. Our interview was conducted by me, Kilaa Slaughter-Scott, a Cambia employee and board member of North by Northeast. So Dr. Jill, can you tell us about North by Northeast? How did the idea come about? And what was the need for North by Northeast when it was started?
Thinking back to 2005, before Obamacare, there were a lot of people in Portland, Oregon, who didn't have health insurance and weren't able to see a doctor for very common and easily manageable conditions like high blood pressure. So that was the idea behind starting North by Northeast. We wanted to provide healthcare services to people that weren't otherwise able to get them. And when we started, we were a free clinic, mostly volunteer run. We started right away focusing on high blood pressure and diabetes. And we've continued focusing on those things. And over the last years, we've become more and more focused on serving the African American community in our city.
I have some questions about the Cuts and Checks program. So it was launched in April of 2015. Mm-hmm. It advances health equity and improves heart health of African American men by engaging barbers as advocates for community health. Wow. I mean, let's just start off by saying that is incredibly innovative. Mm-hmm. Can you tell us more about how the program was started? Tell us about the program in itself. And what made you go out and actually seek to do the program?
Mm-hmm. So it wasn't like a master plan of let's roll this out. It was really that African American men had the highest blood pressure in the world. And like Dr. Jill said, how our clinic kind of moved towards serving the African American community, we were seeing folks coming through the door with really high blood pressures. So we wanted to get on the front end of that and go out into the community and kind of meet people where they're at and educate and inform them about blood pressure. So I think it was Susie and I were talking, the executive director, Susie, we're talking about how to go about reaching folks in the community. So there was only 2 really large places that African American people hung out, and that was either at church or at the barber beauty shop. So since it was the men that had the highest blood pressure, we decided to go forth into the barbershop and talk to them. So the first barbershop, that I went to was really kind of funny. I thought they were going to be, he was real open to us coming in and, having taking the blood pressures. But he put me outside before people could walk into the barbershop. And so I was trying to stop them from going into the shop to get their blood pressure. And I was like, this isn't working. I need to be on the inside to have more of an impact. So we discussed and made some adjustments. And through that, it really kind of opened up the door. So these barbershops signed on to be heart attack, stroke-free zones barbershops. So that's how our Cuts and Checks program pretty much started.
Wow. So you identified a problem, Black men having the leading high blood pressure in the world. And you thought of a solution that works for this community. And you decided to go meet the people who are most vulnerable where they're at. Mm-hmm. And that is the African American barbershops in the community.
Yes.
So can you tell us a little bit more about how you engage the barbers to become advocates for the Cuts and Checks program?
So kind of let's back up a little bit about the culture of the barbershop. As you know, it's a hangout. It's a place where guys come to, I would say, let their hair down. And so the atmosphere in the barbershop was a little different when I was in there taking the blood pressures. And so what I came back and was discussing with Dr. Jill and Susie that, hey, it may be better if some black men be a part of this. And so we took 2 of our patients and we did a training. In fact, we had a couple of barbers as well come and, get trained through Dr. Jill on how to take blood pressures and have some mild discussion about what that meant. And they became our patient ambassadors. So our ambassadors took on the role of going into the barbershop, these 2 African-American men going into the barbershop and providing blood pressure checks, which I felt was a better fit. I was great, but, okay. But they were better. And this kind of sparked, I would say, more interest from the barbers about being a part of this movement. And what ended up happening is we branched out into other barbershops, more barbershops, and decided to say, hey, let's see what happens if our barbers are trained. How much more of a service can they be to their clients? And so we were really working with the barbers on trying to have them incorporate taking blood pressure as part of their service. Like, just make it supernatural. Like, as soon as you put on the cape, put the cuff on their arm and go at it. So some were okay with doing that, and then others were like, no, that's not what I want to do. And we respect that. But I do see that since the barbers have been trained, the ones that are actually doing it, have also sparked more of an interest to the other barbers to want to be a part of it. So we're still training barbers to be, I would say, ambassadors of health in the barbershops. So it's something catching on, but it's growing.
Wow. So it's like the gift that keeps on giving.
There you go. Mm-hmm.
Yeah. Not only are you attacking a problem head on and providing a solution, you're also empowering others with the tools to be able to provide these services in their own community.
Yes.
Wow. Thank you, Sharetta. So Dr. Kenji, you lead a similar program called the Cut Hypertension Program. Can you tell us a little bit more about that?
Absolutely. The Cut Hypertension Program, or CHP, is a program I started as a medical student actually back in 2010 in Philadelphia. And similar to what Sharetta was saying, it really came out of a need we were seeing in the community and information we had seen as Black medical students that these barbershop-based screening events and interventions were actually really effective at getting men into care, specifically African-American men. And we saw in our community in Philadelphia, predominantly African-American community, that this was an issue that we saw. And so it started out from the group of medical students there who had some personal relationships with some of the barbers where they got their hair cut. And we started doing screening events every couple of weeks, and would go into the barbershop. Barbers would introduce us and really encourage everyone to get their blood pressure checked. And we could then identify people who might have high blood pressure and try and refer them to clinics or back to their primary care doctor to get their blood pressure checked. So fast forward 5 years after medical school, the program had spread to another group in Atlanta through a health students organization there, where they had partnered with 3 different barbershops in Atlanta doing blood pressure screening events. And then it followed me to San Francisco, where I trained at UCSF in the Bay Area. In the Bay Area, we had the opportunity to work with a group at UCSF called the Center for Excellence in Primary Care, where they actually had a health coaching curriculum for people who are in clinics to actually, provide health coaching around healthcare, but we wanted to adapt it to barbers. So we've now trained a couple of group of barbers here in San Francisco and Oakland to take blood pressures, provide health coaching for people while we're not doing these screening events. And the next steps that we're working on is actually getting treatment out into the barbershops themselves for those men who have high blood pressure. Because we do know kind of what's the newest, kind of latest information that's come out of Los Angeles. This big, large study they did with barbershops there was when you have a pharmacist who goes out to a barbershop and treats men there who have high blood pressure, their blood pressure over 12 months is under control, and 90% of them keep their blood pressure under control, which was kind of a huge finding. And the question that all of us who've been doing a lot of this work for so many years is how do you scale that across different geographies, different cities, within different healthcare systems, and how do you take something that seems so effective in a randomized control trial, and how do you make that into a sustainable program?
Sharetta, we talked with Jamaal at the Champions Barbering Institute, and we asked him a similar question. Can you please tell me, what is your vision for the Cuts and Checks program for the future?
My vision would be that the barbers would embrace taking on the role of being, I would say, a community ambassador barber for hypertension with their clients, that they take their blood pressures for all of them, provide information and educational materials in their shops for them. I see the community becoming healthier. I see the African American men's who have hypertension, like Dr. Kenji said, below goal, that's important. And seeing that, because it affects the families as well. It's not just the men, but it's also the families. And seeing that happen, becoming a healthier person.
One of the things we've been able to do through our partnership with one of the shops in our neighborhood is this couple who owned a barber shop decided to start a barber college, and that's Jamaal and Christina Lane. And because of our relationship with them that we had built through the Cuts and Checks program, when they started their barber college, we began to work together in order to provide some supplemental curriculum for the barber students around community health. And that's a way to increase the workforce that's addressing these issues. It takes a long time to train a physician or a nurse practitioner or a physician assistant, but barbers get their certification in about a year, and we saw that barbers with more information around community health, issues of diabetes, high blood pressure, nutrition, health insurance, just how to navigate the health system, that those folks can really be great advocates and provide a bridge to the healthcare system that hasn't always been so friendly to the folks that we're serving.
Dr. Jill and Dr. Kenji, can either one of you share any personal stories about the impact of what you've seen from these programs?
Well, I can start. We had a patient, a man walk in our door. He had gotten his blood pressure checked at the barbershop and was told that his blood pressure was high and he should see a doctor. And he didn't have a doctor, hadn't been to a doctor for years. So he came to North by Northeast Community Health Center. And Sharetta checked his blood pressure, and she called me and said, we've got a community member downstairs with a blood pressure of 204 over 125, which is dangerously high. Normal blood pressure is 120 over 80 or below. So I went and talked with him and found out a little more about his story, and he had no health insurance, no doctor, and we were able, by the time he left our office, he had a prescription for blood pressure medicine and health insurance. We were able to get him signed up for our Medicaid program right then and there. So that's the kind of story that we see all the time, people who otherwise would fall through these giant cracks in our system, and we're going to be able to help that guy and keep him from having a stroke or heart attack so he can be there for his family.
Wow. Dr. Jill, that is very powerful. I mean, through this types of programs, you guys are saving lives and also working on preventative health measures. There are health disparities in the community. We are all aware of those. And programs like Cuts and Checks and the Cut Hypertension program It's working. It's working in our community. This is what HealthChangers is all about, is finding innovative solutions that work within the communities that we live and serve. Healthcare is not a one-size-fits-all, and you guys are doing great things in your community to serve the population. What can others learn from a program like Cuts and Checks? And this question is for all of you.
I would say, like, meeting people where they're at. We like you said, we identified a problem, and instead of being open and just saying, hey, we serve the African American community, come see us, we actually packed up our doctor bag and went out into the community to take the service to them. So we met them in an environment that they're comfortable in, that they trust, especially being around or being parts of systems that we can know that there's a lot of mistrust for people of color. So being able to offer that to them in their safe space, I feel like has an effect. Like in 2015, when we first started the program, we did like 565 blood pressure checks. But in 2019, we did 1,324. So you can see that it doubled, and it wasn't just one person. It was like the impact of our patient ambassadors, our barbers, our medical director, different folks coming from different angles of meeting people where they're at to be able to bring this education and service.
Dr. Jill, any words from you?
Yeah, I guess as a physician, it's humbling to work in the community when you're not in your office where you've got all your stuff, your equipment, maybe you've got a white coat that you put on, and we all have, as healthcare professionals, have to be humble and understand that there are a lot of things we don't know, a lot of things about the community, if we're not from that community, that we don't understand, and really allowing the community to teach us as we do this work is one of the things that I hope we can all continue to learn.
So when we talk with Jamaal at the Champions Barbering Institute, we had the opportunity to see the students in action and understanding that not only are they going to barbering school to get a license, they're also learning tools that are health related to help be preventative and save lives and serve our community. It was very inspirational to be able to see that work in action. Speaking of inspiration, can you tell us why you are personally invested in this type of program, and why is it personally meaningful to you?
For me, this work around hypertension, strokes, and heart attacks is very personal. When I was 17, my dad died suddenly from a heart attack, and he hadn't gone to doctors. He didn't really trust doctors. Even though I'm not, I'm white, my dad was a professional, but he still had a lot of the same issues that we see in the folks that we serve today. So when I think about people not having heart attacks and strokes, I think about, kids that are able to grow up and have their dads and have their family intact. And that's really personal to me.
I think why I'm really attached to this work is because, growing up in an African American community, we looked at hypertension, diabetes, those chronic issues as part of life. African Americans, it wasn't like a big thing to have hypertension. It was accepted, or having diabetes, it was accepted. And so when I came to North by Northeast and really understanding the health chronic issues, that this stuff is preventable, this is something as like inspired me as like I can help make a change on the back end on this matter. I can educate people, the community. We can talk about that this is not a normal issue that families face, but to be able to see folks' lives change and seeing African American men growing with their families and not having them, I think our jail systems, we have a lot of systems that take our African American men away from our families. So seeing them being able to be healthy and stay and live long lives is important to me. And to be able to be a part of helping them see that has been real inspiring to me.
That's awesome. And Dr. Kenji, for you?
Yes, similarly, Jill, it's so interesting. This hasn't come up over the past year or so that we've been talking, but we share a similar story. 2 years before I started my medical school, my father's African American, also passed away suddenly from a massive heart attack. He never went to go see a doctor. He was uninsured, couldn't afford to go and get the bill at that time. And he grew up in the South, with my aunts and uncles at a time when segregation was still, very alive and real. And so I think before going to medical school, I didn't realize that this was a thing, really. And I think as this, when I got to medical school and realized that one, African Americans are such at risk for cardiovascular disease, in particular high blood pressure, that it's very, very preventable. And also that the impacts of it really hit our community much harder than any other community, in this country. I think were sort of a lot of just aha moments and light bulbs that came on in my mind in terms of what kind of doctor I wanted to be, and also what kind of work and connections I could make into the community as a physician using that platform. And so, I've continued to see, unfortunately, that those same stories, whether it's someone who comes in the emergency room or someone who I see in clinics who's had a stroke or whose kidneys have gone out and they're on dialysis, or they have heart failure, they have a heart attack because their blood pressure has just been uncontrolled for years and years and years. And they just don't have the information that's out there to get them into care. And there's so many barriers to actually, for a lot of these guys and African Americans, to get into, the system the way it's set up right now. And so I think that's always been from a very personal place, but also just reinforced in my daily experiences as a family physician.
Wow, thank you for sharing that. So I am Kilaa Slaughter-Scott, and not only do I work for Cambia Health Solutions, I also serve on the board for North by Northeast Community Health Center. And the reason why it was so important for me to serve on a board like North by Northeast is because not only am I from Portland and grew up in the community in Portland, Oregon, I am among the community. I have seen my community impacted by preventable diseases that we have normalized in our community. And I always wanted to provide impact in my community. How can I, behind the closed doors, help to change our community? How do I help to make our community better? I've always had that passion. So having the opportunity to serve on a board like North by Northeast and have the support of a company like Cambia, who backs up an organization like North by Northeast, is just a match made in heaven and a dream come true for me. I think it's important for all of us to work together as a community to help change our thought process for all people. How can we think about being healthy? What does that look like for our community? And how do we empower and support programs like the Cuts and Checks program and the Cut Hypertension program to empower community members? And so that is my personal reason of why I serve. So I would like to say a big thank you to everyone for joining us today, Dr. Jill, Sharetta, and Dr. Kenji.
Thank you.
Thanks so much.
Thank you. Thank you very much.
Of course, healthcare initiatives like the Cuts and Checks program can only work with the full participation of community leaders. Next, we're going to meet one of the people who's been key in making this program work. Jamaal Lane is the owner of Champions Barbershop and Champions Barbering Institute. I spoke with Jamaal in his Northeast Portland barbershop. Our conversation took place last year before the pandemic hit. Jamaal, can you tell us a little bit about your background in the Champions Barbering Institute and how you got where you are today?
I can do that. Thanks for asking. Thanks for having me. The background, first of all, that goes back to a young man. Let's just say I'm a proud native of Northeast Portland. And when I was in middle school at Harriet Tubman Middle School back in that had to be 80, 88, 89, somewhere in there. Fashion was everything. Hair was everything back then. Hip hop was heavy. And, the way you wore your hair was very much a part of who you were. And so my mom, she tried her hand at cutting my hair a few times, and to not absolute good results. And I had to take things into my own hands, and in the beginning it wasn't something that I was very good at, but it did kind of come to me naturally as I began to cut my own hair. And it actually looked a lot better than a lot of people who was going to the barbershop. So at a young age, man, I felt like it was a gift that was given to me. And I just kind of not knowingly began to cultivate my barbering skills as a young man. So I began to cut my hair, cut my family's hair, friends' hair, in middle school and in the beginning of high school as well. And because that kept me out of the barbershop, actually. And so I didn't really go to the barbershop much. I didn't know what it was to really be a professional barber. But the skills of barbering was something that I was developing. Didn't really have a desire to be a barber because I didn't know what it really meant to be one. But as I got older, I began to cut more and more hair. Learning, life's lessons, becoming a young adult, found myself in various different areas of employment. But I ended up going to barber school, as a result of, I had gotten a car accident actually, and it kind of took me out of doing some of the laborers jobs that I was doing. So I decided, I said, hey, I might as well go and do something I already know how to do, which was cutting hair. And so in 2003, 2002, I enrolled at Beaumont School of Hair Design in downtown Portland and became a professional in 2003. From there, I took my first position, which was at Reggie's Barbershop. It was one of the, it wasn't one of the first barbershops, but it was a barbershop that stood out, should I say, in my generation. And so, I started there in 2003, built a name for myself over the course of about 5 years, and opened up the first Champions Barbershop in 2008. That was a great experience. Did a lot of work in that shop. It was a 10-chair shop, or we built it up to be a 10-chair shop, and focused on being, a pillar in the community, a staple in the community. Wanted to bring that feel back, and we definitely accomplished that. Ended up being ended up opening up another location like 4 years later. So in 2012, opened up another shop out in Beaverton. I'll say over the course of those years, I realized that I really had that entrepreneurial spirit about myself. And so matched that with my barbering skills and just kind of went forward with it. And so, learning how to be a professional barber and learning how to be a shop owner all at the same time turned out to be a great match for me. It took a whole lot of work, a whole lot of sacrifice, but it turned out to be a great move for me and my family. So let's see, 2012, started to see kind of, opening up the shop, starting to see the talent come into the shop, it wasn't what it should have been. I didn't feel like the barbers were getting the attention that they needed going through school. It wasn't cool. And I feel like me having to retrain them on all these different things, like I was doing work that the school should have done. And so that was bothering me a lot. It was very, very frustrating. And also when you looked at the complexion of the barber school or cosmetology school industry, it all was the same. And I felt like, why can't we be a part of this too? And so I would always come home to my wife and vent about the whole situation. And I was so frustrated. And, she said, well, why don't you open up a school? I said, yeah, why don't I open up a school? I'm going to open up a school. We going to open up a school. And so it kind of started from there. We kind of, just kept speaking it into existence. Then decided to move forward with the work to make it happen. So it's a beautiful thing right now.
So you saw a gap in your community, and you decided to step in and bridge the gap. And speaking of stepping in and bridging gaps, let's talk a little bit about the Cuts and Checks program through North by Northeast. How did the Champions Barber Institute become involved with the Cuts and Checks program, and why was it important for you personally to get involved?
This goes back a ways, too. me and Dr. Jill, I don't even remember how we even met, honestly. I think she just came into the barbershop one day like, hey, I'm Dr. Jill, what's up? But she was so cool with her approach and how she came to the shop. I kind of took to her a little bit, and, we started this conversation. Also, her and Sharetta Butcher, she also came to the shop with the idea. It was really just an idea at first of the Cuts and Checks program, and I thought it was a cool one. The fact that they wanted to involve the barbershop to bridge that gap between, black males in the community and health, good health, and providing a place for them to actually get their blood pressure checked, amongst other things, right at the place where they're comfortable. You know what I mean? So a lot of us don't go to the doctor for fear or just not being comfortable, but we always go to the barbershop. And I just thought it was a great idea. And again, it was something that we talked about and we just kind of worked towards. And so it really started in the barbershop, and being able to train the barbers on how to, conversate with their clients about their health issues and ask them, are they experiencing anything, abnormal? And when was the last time you had your blood pressure checked? And so just having that conversation, because, at the barbershop, you talk about everything. And so why not talk about your health, and making sure that we are right. And so that's how that actually started in the barbershop. And then it was crazy because we had conversations, me and Dr. Jill had conversations about how about we just start, I think we both were talking about moving locations at that time. They were going to move the clinic and we were talking about moving the shop. And we was like, well, how about we just have a shop or a school with the clinic, we were talking about opening up the school. And it was like, why don't we just put them together? They ain't never seen nothing like that. We have a health clinic and a barber college, and then we could, integrate the Cuts and Checks program together, and boom, we got something that we can put all over the world, right? And so we just, we'll continue to talk about it. That immediate thing didn't happen, but because of the conversation, that's when the Scholars program, kind of was birthed, and being able to have students here at the school learn how to be a part of the Cuts and Checks program as well, and learn all the same things. So as opposed to already being a professional in the shop, they can go into the shop, learning or knowing these skills, and that's just another feather in their hat, as a professional barber. So that's kind of how that started.
So, Jamaal, you mentioned that people come into the barbershops and they talk about almost anything. It's pretty well known that within the black and brown communities that barbershops are a sacred place. It's a safe haven for men to be able to come in and have what we call therapy. It's therapy a lot of times. Why did you allow a program like Cuts and Checks to be embedded in the barbershop? And did you feel that you had a responsibility to play at all in bettering the lives of people in the community? Can you tell us a little bit about why you decided to make this investment?
Yeah, absolutely. Well, for one, Champions Barbershop, when we started out, it's all, and still today, it's all about the community, and playing our role in the community to the fullest, right? However we can. And so the Cuts and Checks program, it's about showing it. You can say it, but you got to actually do something. And I feel like this was another way for us to actually be active in our support of the community. And health is everything. You know what I mean? It's one thing to look good, but you gotta take care of yourself as well. And so being at the barbershop is such a trusted place. People are willing to open up a little bit more about the things that are going on in their lives. And why wouldn't you do, this type of thing in the barbershop? And so that's why I opened my doors up for it. It was just another way to help, the men in our community be better. You know what I'm saying? And you got to start with yourself, health-wise in order to do that. And so I did feel like it was a responsibility, definitely.
So having that trust factor, talking about things other than in sports or what's going on and pop culture or the streets and having to talk about something a lot more serious, which is health. It's something that at times people could shy away from that, but by allowing Cuts and Checks to be a part of the Barbering Institute and bringing it into the shop, you were bringing up a more serious topic. Can you tell us how have people reacted to this program?
It's been a great reaction, I would say. In the beginning, I think that people were they didn't know what was going on. They're like, you doing blood pressure checks in the barbershop? Like, I'm just trying to get my hair cut. And then there were other people who were like, oh, absolutely, man. I would love to get my blood pressure checked. I don't know when the last time I've been to the doctor to get my blood pressure checked. And so the reaction has been, in the beginning, it was like, some people was with it, some people wasn't. But because they see the benefit behind it, more people have become receptive to it. And the cool thing about it is that people are seeing from having those checks in the barbershop, you might find out some things that you wouldn't have known otherwise. And then from there comes, being grateful that that opportunity was there for them to get that blood pressure check, because things could have been bad. We've had situations where people have been extremely high blood pressure, man, and had they not got that check in the barbershop, ain't no telling what, would have been, the result of that. So it's been received very well. The barbers have adapted to it and found their place in it. And I just think it's just a beautiful thing. The community understands now what it is we're trying to do from it. Our partnership with North by Northeast has done nothing but get stronger because of it. And I feel like it's branched out over, to different shops. So everybody's getting an opportunity to take part in it. Yeah.
That's excellent, Jamaal. Can you tell us a little bit more about the health-related practices that students are learning going through the Barbering Institute?
It's wild because how everything has come full circle with that. Because when you look at going back to the ancient times of barbering, not only did we cut hair, but we were the healers. You know what I mean? The only people that were, allowed to actually remove hair were like the high priests. And so, of course, they were the same ones that were entrusted with healing and different medical procedures, the medicine man, and he was also the same person that removed hair. But this was the person that looked out for the health and well-being of that, immediate community or tribe or however you want to look at it. But we still, we want to hold, true to that. And this is a great way to do that with the Cuts and Checks program. And so we make sure that we're continuing that legacy of making sure that the community is healthy, not only looking good. And by the Cuts and Checks program, all the things that are introduced with that, I mean, when they study nutrition, they study diabetes, they study, the skin and hair disorders, high blood pressure, all those different things. That gives our students even more knowledge that they can carry into the barbershop, which is a great thing. And that just makes them more valuable to any shop that they go to, and even more valuable to our community as a whole. And so I think that's big. It's huge, actually.
So, Jamaal, you are in this every day. A lot of times when people are making change, they don't see the bigger impact of the change that they're making in their communities, because you were just doing this. You're doing this. This is implemented in the Barbering Institute. You guys have acquired the skills and the knowledge to be able to go out and execute into our community. And it's natural when you're sitting down with your clients, having conversations, putting that blood pressure cup on, checking for blood pressure, signs of high blood pressure. Can you tell me a little bit more, and not just me, tell all of our listeners, what advice would you give to anyone who is looking to make change as it applies to healthcare in this country?
If it's on your mind, on your heart, that this is something that you should be involved in, don't hesitate. I think it's something that's extremely important. If it isn't on your mind or in your heart at the time, do some research. Take some time to do some research on what is the reality of health in your community, especially in the Black community. And hopefully that will stir up, the reasoning for you to get involved, because it's something that has to happen. We all need to be taking better care of ourselves. There's a lot of things out there, generationally and systematically that have put us at a disadvantage when it comes to healthcare and taking care of ourselves. So we have to take it upon ourselves to make sure that we're taken care of. And so I'm just thankful that we have, organizations like North by Northeast that are willing to bring this to the forefront and to team up with the barbershops because it's a great partnership and it's very much needed. And we're able to reach even more people. Only so many people can be taken care of in one spot, but when we're able to, branch out, even more people can be taken care of from it. So I say go for it. This is something that needs to be happening all over the country, all over the world for that matter. But for the most part, right here in our Northeast Portland, we got to make it happen.
All right, Jamaal. So what I hear you saying is if people have a cause on their mind or on their hearts to actually get up, do something about it, it starts with community. We do know and understand that there are healthcare disparities within Black and brown communities. Let's focus on the community that we work in and we live in and we serve. Can you tell us a little bit more about how you have seen how this program has actually worked in your community and the people that you serve?
Well, I've seen up close and personal situations that it's benefited clients of mine, clients that have come in. You can tell that something wasn't quite right. You offer them first you educate them, after you get, certain feedback from them on how they've been feeling or what they've been experiencing or whatnot. And then when you give them that check and you realize that those scores are through the roof, and then you send them to the clinic and they go to the clinic just to find out that they was borderline this or borderline that, or maybe they didn't have health insurance. And so the clinic is able to, stand in the gap and get them to where they need to be, get them the medication that they need, get them, insurance or whatnot, and put them in a better place. And so I've had people come back to me, so thankful and appreciative for having that opportunity in the barbershop because they probably would not have done it. And who knows what the situation would have been had they not got that help. So, and I've seen numerous cases of that. And so it's a reality that people need it, and people aren't really going to the doctor the way they need to. So allowing that barber chair to be that place of connection is huge. It's huge. And so, it's something that's definitely needed, and we go definitely continue to do it.
Awesome. Thank you, Jamaal. This is powerful what Champions Barbershop and Barbering Institute is doing in partnership with North by Northeast. So thank you for allowing us to sit here and talk to you today at Champions Barbering Institute, sitting here in the classroom with Jamaal and some students. And so we really appreciate your time, and thank you for being a health changer.
Thank you very much for having me. Continue to look forward to being part of my community in various ways. Maybe we can do some more things with HealthChangers in the future. And, be great.
That was Jamaal Lane of Champions Barbershop in Portland, one of the community partners who helps make healthcare initiatives like the Cuts and Checks program work. As we mentioned earlier in the program, these conversations were recorded last year before COVID-19 upended all of our lives. Barbershops like Champions had to close for a while in order to slow the spread of the virus, but Champions is open again with safety measures to keep customers and employees safe. And that means the great work of Jamaal Lane and other barbers to keep an eye out for the health of the Black community is continuing. On a future episode of Health Changers, we'll revisit Champions as well as North by Northeast to talk about how the pandemic has impacted their businesses, disproportionately affected communities of color, and how calls for long overdue racial justice over the past year have helped to shine a light on injustice in our healthcare system. And that's a wrap on this episode of Health Changers. You can find more information on all of our episodes at cambiahealth.com. You can also follow us on Twitter at Cambia, CAMBIA. You can also find Health Changers on all of your favorite platforms. Just search for Health Changers on platforms like Apple Podcasts, Spotify, and Google Play. Please subscribe and leave a review. Thanks for listening.